Hi, I'm Dr. Manna Semby. I am a naturopathic doctor at the Center for New Medicine. Today, we will be talking about a specific ozone treatment called ultraviolet blood irradiation with ozone, and we call it UBI for short. So, what is ultraviolet blood irradiation with ozone, and how does it help patients? So, first of all, a little bit about ozone. Why is it helpful? Ozone is a therapy, a modality that we use that has many uses. We use it to increase oxygenation in the body, to increase peroxides in the body. And ozone is an oxidant, and what it does is, as it goes into your body, it engages the body's antioxidant systems to rally forth and engage further so that your body has antioxidant systems pretty much in every organ except in the lungs. So what ozone does is it goes in and engages the antioxidant systems to do their natural job more efficiently. What it also does with ultraviolet is that ultraviolet light is an antimicrobial. So when we are sending ozonated blood through the ultraviolet blood irradiator, it also has an impact of killing pathogens like viruses and bacteria. So often what will happen is if there are patients that have high viral loads, like somebody has high loads of EBV, Epstein-Barr virus, or herpes simplex, HSV, or cytomegalovirus, CMV, or different kinds of viruses, even Lyme. What we have found is that when patients get a number of these treatments, generally it's a series of about 10 to 12 treatments, and they'll do twice a week for 5 to 6 weeks. Generally, what we see is when you do this treatment, patients report feeling more energy, less brain fog, just more able to do their daily routines. They just have more energy and less fatigue. And then over a period of time, once they go and do their labs before and after, often they're able to see that their virus loads has come down. So that's really gratifying to see that. Another thing that we see is, in addition to energy, the blood glucose goes down. So your metabolism is helped by getting these ozone treatments. So if you tend to have high blood glucose, after you do these treatments, when you check it again next morning, you will notice that your blood glucose is lesser. Patients report their joint pains being lesser, just overall a better sense of well-being and just feeling better. To keep in mind for PrEP is that we use heparin, which is a blood thinner, when we do any ozone treatment. Whenever the blood is outside your body, its job is to clot, but we are interested in sending the blood back into your body, so we always use a little bit of heparin when we do the ozone treatment. So this is a Heparin Flush, and this is 500 units. So we use, I take this with a syringe and put this into a 60 cc syringe, and I have 2 of these. So there's 10 mLs of heparin in both syringes, and what we do is we draw this much blood, 60 cc of blood, 2 of these from your veins, and then we put it into a saline bag, and then we add ozone into that, and then we run it through the ultraviolet blood irradiator back into your body. Okay, so I mentioned that we take the blood mixed with heparin and we put it into a bag of saline. So here is a bag of saline, and we drained quite a bit out of it, so we have about 100 to 150 mLs of saline still left in the bag. Now this tubing is connected to this ultraviolet blood irradiator. So this is the ultraviolet light in here, and this tubing has this section where the blood slows down as it goes through the ultraviolet light. So here is my ozone ready. You can see these are 60 cc syringes, and there are 6 of them. This is a machine that we use to convert the oxygen from the oxygen tank, and this machine turns it into ozone. And then we choose the concentration of the ozone here. So this one we are doing at 70 gamma, which is the highest concentration of ozone that we can go to. And so we've extracted from this machine 6 syringes of 60 cc's ozone at 70 gamma each. So what we will do is we'll extract the blood from the patient and we'll inject it into this bag. Then we'll inject the ozone into this bag, mix it up, gently shaking it, and then we connect the drip. We start it to the patient, and then the ozonated blood will just run down the tubing through the ultraviolet blood irradiator back into the patient. When the patient is getting ozone for the first time, some things to watch out for in terms of kind of a reaction or a side effect maybe. You may have a slight headache, you may feel a little bit of chest tightness. I know at least one patient who had a scan with a contrast dye. When she had the first UVI, she kind of had like a detox reaction like a skin detox reaction. There was a rash on her face, on her neck for a few days, and then it went away, and after that she came back for subsequent treatments and it didn't happen again. So there can be some detox reactions, but they're very rare. I haven't seen that many in all the time that I've been doing these. So I haven't even heard reports of headaches or chest tightness, as I was saying. One of the patients got symptoms of flu, but in all the patients that I've been doing, I've had only those 2 patients that complained about any kinds of side effects, and those were time limited, and then they came back for subsequent treatments and didn't happen again. So I'd say overall it's a pretty safe, benign treatment, and generally patients feel better, more energy, less fatigue, less pains. Thank you for joining me today. If you have any questions about UVI, you can leave them as a comment under this video, and we'll be sure to get back to you. And for more information, contact the office to schedule an appointment. Just call the front office and they'll get you going.